goniometric measurement for hip medial or internal rotation. Normal range of motion 0 to 45 degrees. Testing position, seat the subject on a supporting surface with the knees flexed to 90 degrees over the edge of the surface. Place the hip in 0 degrees of ab and ad and in 90 degrees of flexion. Place a towel roll under the distal end of the femur to maintain the femur in a horizontal position. Stabilize the distal end of the femur to prevent abduction, adduction, and further flexion of the hip. Avoid rotations and lateral tilting of the pelvis. Place one hand at the distal femur to provide stabilization and use the other hand at the distal tibia to move the lower leg laterally. The hand performing the motion also holds the lower leg in a neutral position to prevent rotation at the knee joint. The end of the range of motion occurs when attempts at resistance are felt and attempts at further motion cause tilting of the pelvis or lateral flexion of the trunk. The normal end feel is firm. Center the fulcrum of the goniometer over the anterior aspect of the patella. Align the proximal arm so that it is perpendicular to the floor. Align the distal arm with the anterior midline of the lower leg using the crest of the tibia and a point midway between the two malleoli for reference. Get your beginning measurement, take them to 0 if they can get to 0. Then take them to end range. Repalpate your landmarks and realign your goniometer. And get your end measurement.